So our next speaker is Lesley Ann Carlson, and she is the Associate Chief of Nursing Officer at Rady Children's Hospital here in San Diego, and she's going to be talking to you today, to us, about patient advocacy. Thank you, Lesley. Oh, and I also to you now or afterwards. Oh. This is what you have to say. Thank you for you.
Thank you. And she didn't mention she's actually family. So my sister is married to Rob's brother. So we're family. And then when I heard they were coming out to San Diego, I was so delighted that I'd get a chance to see them and get to talk to you. So I'm going to talk to you more from my experience. I've been at Rady Children's for 35 years, and my experience over the last, I'm hitting buttons, over the last 10 years before my current position was I was the director over the emergency department at Rady Children's. And so we at Rady Children's, we have over 70,000 visits a year that come into our ED. So we see a large percentage of the population in San Diego and San Diego County. And then as well, in the summertime, we see a lot from around the world because we're such a vacation destination. So we really, even though Jacobson syndrome may be a smaller syndrome, we certainly have exposure and see patients. But I wanted to talk to you about experience I've seen with families that have children with chronic illnesses or different syndromes, of the best way to advocate as a parent for your child if you're going to encounter the healthcare system. And the challenges I know you can probably address and be the experts on it far more than me that works in it from your perspective of having to interface with it. But I'll give you what I can of a few tidbits that I've found. Families that engage in these activities seem to have a smoother ride through our system and through healthcare in general, with some very easy activities that they can do, and that I'm sure you already have done to some extent. So I hope I'm not being really redundant for a lot of you, but bear with me and I'll go through all the steps. The first thing I think that's most important when you're engaging with people that may not be familiar with your child or this particular syndrome is to come prepared with as much information that you can give them in a very brief overview that prepares them for what they may be encountering as they go. When children come in with us and families tell us, oh, my child has blank, 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 even though I would say the experts at Rady Children's, my nursing staff is fabulous to keep track of all the different syndromes and all the different presentations they are, is very difficult. But families that walk in and hand us a sheet, a one-page info sheet that says, my child has Jacobson syndrome, and here are some of the key points about this syndrome. It gives them right away an overview, because you know what the nurses will do? They'll take you back into a room. They'll go back and ask, does anybody know what this is? Has anybody seen a patient with this before? And then you know what their next step is? Google. Right? They're going to go Google it. And they're going to get what they get out of that first Googling. Where if you come and you show them that I've already Googled it, not only Googled it, I'm living it, I know what this syndrome is, I'm going to give you the high points, because you don't need the whole thing. I'm going to give you the high points that are pertinent and important for my child, my presentation, my situation. Here's what it is. It's extremely helpful to staff. When they get that, it gives a couple messages. One, it's, I value you having knowledge about this. I also want you to value me having knowledge about this and being knowledgeable about my child and my processes. And we're going to share this together. And I welcome any questions you may have of me, and I'm going to have questions that I'm going to have of you. So handing out a handout, and you can either take it off the internet if you like anything that you found, or if you want to just type something up that says, here's the key points I want you to know. There's many different ways you can do this. It may be your group. You've already done something like that. You don't know. I'm sure you probably have or have access to that. But that is the most important thing that you can bring with you to any visit, is bring people information, because that's going to guide them, it's going to educate them and keep them on the same course with you. There's nothing, I'm sure you can tell us, there's nothing more frustrating than when people don't know anything about it and they don't take the time to ask you about it, or they don't share with you information about what's going on. So I think that's a key component. The other component, I think, for Jacobson syndrome I would do is you need to really put down the risk factors that you're worried about for your child. Because there's a lot of different, in this syndrome, there's a lot of different risk factors, right? And a lot of different presentations and situations. What you want to have is what's relevant. Here's the syndrome, here's the key information you want to know. Here's the risk factors, the things I'm worried about for my child. If they have a heart impact to it, if they have a hearing, if they have a blood disorder, these are the risk factors or the things I'm most concerned about related to my child in this disease. Because that's really, I'm not here to teach you, you're telling the providers when you go, I'm not here to teach you about it necessarily. I'm here to make sure you're aware of the basic information that's going to affect my child and my presentation, because that's what's the most important to me. If you want to learn about it, you come to this conference and we'll teach you more, right? More in depth and talk to you about it. But this is what I need. And I'm going, again, I'm using this somewhat as an experience. It could be in any encounter you have with healthcare, but I'm talking about parents that present a lot to the emergency department. And the emergency department, when you're talking about, you know, a lot of different presentations of a lot of different people, they're triaging what's the most urgent, you know, emergent, all of that. When you come ready to go, got the information, you're just making your throughput a lot easier. And when you're identifying, here's what I'm worried about, okay? The second thing that I think, the second topic that's on your handout there, that I think is the most other important concept you can bring is your child's history, your child's data. What do they need to know about your child? You know, nowadays in the information technology, 30 years ago when I started there, we would call up and try and get medical records to find the chart. And that was, you know, in a room with files and files trying to find charts. Or we'd call other hospitals or other providers, can you send us, you know, the data, what was the child's last visit, what was their last blood count, trying to find out all that. Nowadays with electronic transfer of information, it's much easier, it's much faster. Physicians can look it up online, they can call over and have things electronically submitted. But the number one tool I think that you could have that's the easiest when you're going to encounter your healthcare professional is this right here. It's a little thumb drive. And if you can keep and carry this with you at all times, have this in your child's pertinent information that you want, and hand this to them, they will plug it right in and they've got it and they're good to go. Okay? So when they want to know what the last platelet count was, or what the last O2 sats, or anything about when was the last visit and what did they do there, you've got it. Okay? And this is data you can put on yourself. It's just you're ready to share it. Now they may want to go and still, let's get the chart. If they came into Rady's, we would have the chart and we would have it all there. We'd go electronically. But when you can give this to the triage nurse right in emergency department and say, here's all the information you need to know about my child, the last visit, the most important stuff, it's very, very valuable to them. They can get things started right away and get going. So you want to put your past and the current history. So what has been the past? And I noticed just on some of your boards there's such great information. Here's when they were diagnosed. Here's the last visits. Here's the physician that's following us. You're here in San Diego. If you walked into Rady's right now, that's what you want to know. Who's your current physician? When's the last time they were seen? Have they ever had this happen before? What's the last, all the things that have been going on. They've been followed for the last 10 years. They've been this and that. So you have a history. Because, you know, if you're in an emergent situation or you're concerned about your child, what happens to your memory? You're stressed. You're sitting there. I can tell you, we've had families come in and they're there for 2 hours, and then they'll come and say, oh yeah, by the way, my child has blah, 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 blah. Oh really? That would have been nice to know 2 hours ago, because we would have gotten you in faster, or we would have already ordered a test on you. We would have something have started already. But parents are stressed. They're concerned about the immediate event. The cut that's on the hand, the pee that's stuck up the nose, whatever it is that's the emergent at the time is where your focus is. So that's why when you have this and you have this updated, it's such an easy tool for you to just hand, and you don't have to worry about remembering it, thinking about it, whatever. So having the past and current history. And then anything pertinent, anything you really want them to know, anything that's really been the most important event in your child's life related to their syndrome. What has been the thing? It may be the whole cardiology workup. That may be the most important and pertinent information you really want them to know. Everything else has been fine and steady or whatever. So what's the most critical and pertinent thing with a little short synopsis about that? Certainly if they've had surgeries or anything going on with that. And then response to treatments. If this is a presentation that's similar to what they've been in the hospital before or presented to a physician before, what has been the response that you saw that was the best? You know what, when we did this before, we came in and they did this, this, and this, and my child really responded well to that, and we were out and things were good. That's what you want to know. So if there's something that's a recurring event, you really want to tell us what worked best for you. Because you're the best advocate. Again, you know your child, you know what things are going to work. We don't, so we may go by the textbook, and the textbook may not fit your child. So we want to go by your fit, your textbook. What fits for your child? Where did you feel the best responses from? And sometimes it's health stuff, sometimes it's behavioral things. You know, our child, last time when they were in the hospital, came and presented to an emergency department or a physician's office, when they did this, when they gave them a toy, when they gave them a iPad. I was watching Elise and she was loving that or whatever. They were much calmer, they were much more engaged with the physician, they were easier to work up or examine. Whatever it is that really works well for you and your child, tell us. As a nurse, I want to know. My child does a lot better if they're allowed to sit on my lap or be with me. Or they do better if I'm not in the room. Or whatever the uniqueness of what you've seen in the past has been the best response for your child, share that with us. We'll put it in the computer, we make notes, we make sure we want to get the best outcome for you, and the best is when we work together and we know what you need from us and then what we can do to help provide for that. But I find when parents sometimes, and I'm that way myself, here I'm a healthcare professional, been a nurse for 35 years, and I walk in and I am the most compliant, okay, yes, whatever. And inside I'm going, oh, I can't believe they're doing that. I wish they'd let me. Or why are they taking her and not holding her or doing this? Why are they holding her down? Let me do it. And that's going on in my mind because I'm not assertive enough to share because I defer. They're the experts. I'm the mother. Right now I want the experts to take care of my child. But really, you don't want to forget that you're the expert about your child. For some of the diseases and different emergent processes and everything, we may have an expertise, but our expertise are merged together when we get the best outcomes. So you're the expertise of your child. Please do not hesitate to share that information with people. And don't hesitate to demand it. No, I need to be in the room with the child. No, I need to have them sit on my lap. I need to be the one holding them. They respond better. Do it. There's very, very few instances where we would say that's not allowed or you can't have that happen. And if you run into institutions or places that tell you that, you need to escalate it. You need to ask why. I need to speak to a supervisor. I need to speak to somebody else. That's really the advocacy you want for your child. Because there really are no rules when it comes to children. We really want to say, what does the child need best? Adults were a little more rule-oriented too. No, you will not get out of that. You need to be discharged by 11 o'clock. In pediatrics, we don't do that. So don't be afraid to escalate it if you really get a pushback or somebody saying, well, we don't really allow that. Say, well, I need it for my child and the best outcome for my child with this syndrome and their presentation and their needs. I really need to ask for that. And it's rare that they won't help you get it, okay? So I talked about responsive treatments. I talked about the thumb drive. And do not be hesitant to talk about your areas of concern. The concern you really have a risk, because you may feel very comfortable, and feel like, okay, I know they're going to have, this is a cut, they're going to have to get stitches or whatever. But make sure you talk about your concern. How am I going to treat this later? This child is very active. How are we going to bandage this or keep this clean? How am I going to bathe the child? How am I going to do whatever it is that you've got concerns moving forward, that you may be very comfortable with immediate treatment and what we're going to do for the child, but how am I going to handle this when I go home? if this is a continuation or something's going to happen later, what is going to happen. Or if you are worried about the bleeding risk or for platelets and all that, you want to talk about that. If you're going to have to sew this up, what is your concern or what is your method for minimizing and handling the risk factor related to bleeding? Because that is a concern I have for my child. They've bled in the past, or it's been difficult to stop it, or it wasn't bandaged well when we went home. Whatever it is that you have, make sure you share your concerns and your risk, okay? And so that we can address it. Because we may be very, I mean, again, we see so much that we may not have a concern about, and as we get going through this day, we may not have a concern, oh, that's easy, oh, it's just a scalp lock, we can sew that up, we can do staples, we can do whatever. You want to say what your concern is related to that treatment, if there is one going forward, or if it sounds risky to you, or it sounds like there's going to be something that's going to drive another practice for you and you're unsure of. Because we usually don't take it to that step. But for you with your child, that's helping to remind us again that you have something that's unique, that's a little bit different. Yeah, this may be the normal presentation you would see of a cut or whatever in a 2-year-old, but for my 2-year-old with Jacobson syndrome, these are the concerns I have with how you're going to treat this now, from what you just told me. Or taking an x-ray even and having a child go in and have an x-ray. We can put lead aprons on just like we do when we go in, so we can get you dressed up and do whatever you need to go in. And in our ORs, we take patients all the way through now to induction, where you can be present now with the child as they are given the sedation, so the child is with you the entire time till they're sedated and they take the child. And then you can come right back when they're waking up. And most, I was interested walking around, because most areas where you're all living that have institutions, whatever, have some processes now for that. It's pretty much state of the art. It's pretty much what everybody's going to. So that leads to my next topic, was the choice of facilities. So many times we don't have a choice of facilities. Depending on where you live, you may not have a pediatric hospital right there. I know in Alpena, Michigan, there's not my sister lives, there's not a pediatric. And she would call me all the time, can I take, my kid to here or there, here's what we got, or should I drive them 2 hours to, where was it, Lansing or oh, some other city she'd say, I didn't know where it was. And so that's important for you to look at as you're looking at your child, is to have some dialogue or with either your primary care physician or whoever is, if I have the following, if the following was to occur, will the facility that's closest to us be able to handle this? Or do I have time to take and go the extra 2 hours and drive to a specialty area to have this done? There's some situations in emergency you want to get to the closest and fastest ER you can, right? And get, it's a true emergency, and that's why I wrote emergent versus urgent versus routine. So you really want to work with your physician, your primary physician, and talk about what are those 3 kind of areas that I should be looking at, what I can do. How many of you live in a town right now that does have a freestanding pediatric facility? Okay. So some of you. So if you do, nothing in the first 2 things I talked about change. Even if it's a freestanding pediatric expertise, just like us here at Rady's, you still want to come and with the information and all about your child. It doesn't change anything. We're the experts about kids, but not necessarily all disease processes awareness. But if you don't have a pediatric, then and you're going into a facility, then you really are competing with a broader range of those practitioners of what they have to know and be aware of. Just like at Rady's with the new EMTALA laws, an adult can walk in. We treat a lot of adults. In fact, we've given birth, we've birthed 5 babies. We don't do that. But with an emergent and anybody that walks in, we have to be prepared to treat. And we take care of all of our staff. So any visitors or staff that have a heart attack or a stroke or whatever they brought down to the emergency department, emergency nurses are required to have that expertise to be able to treat that type of emergency. So I don't want to scare you, whenever any ER you're going to go to is going to be able to handle your child and treat that emergency. They're going to certainly be augmented by any information you have and what you can share about it. Okay? But if you have the opportunity of some choices, I really want to go, if it's an elective surgery or it's a test that they want to get done, if you have the opportunity to be able to take the child to a place where you feel is within a reasonable distance and place to go, then I would highly recommend that you explore that option and see what it means to that, to be able to do that. But you want to be very clear that you have a good handle, and you probably talking to your primary care of what's emergent and what's urgent. So you don't want to bypass an emergency department if it's truly an emergency and you want to get there. But if it's clear and you've talked to your primary and you've talked to a physician that looks like it's an urgent situation that could take a 2-hour drive, then you might want to do that. Now, are the people in the room, I saw that are from like Norway or whatever, a few more challenges, don't you, in that. But I think choice of facilities and where you're going to take your child and where you're going to try and facilitate the best treatments and the best option for your child is really related to your metropolitan area, your resources that are within your range, and what the dynamics of your child's needs are. That most of them may be able to get very well in this place, but I would say if you probably got the referrals. If you're going to do anything with heart, you're probably going to want to go to a pediatric cardiologist and have that workup or that kind of referral or expertise with that, because they're the ones that deal with it the most for pediatrics. And a pediatric heart is very different than an adult heart. But probably a broad range of some of the other things that you're dealing with could probably be handled within your community with some experts, with your help and with your guidance of what your child's needs are and your child's risk and where they want to go. Okay? But I find a lot of parents go, oh, I wish I'd come here, 2 years ago. I wish I'd come to Rady's. It's another 45-minute drive down the freeway, but I wish I would have taken the time and done that first, or come here or seen somebody. And I say, we're always here. You can always come. You can always do that. The other thing is that don't hesitate to go and check your facilities out before you ever need them. I oftentimes get families that want to tour our facility, want to talk to me as the director and want to say, can you tell me, here are my fears or my concerns, can you tell me how you handle this situation, so that if I ever do come in, I have an awareness already of what kind of things are going to happen, and I can do some prep with my child, or I can talk about things or whatever. So don't hesitate. It's always better in a wellness state to come and get information and tour and bring your child. We facilitate that a lot. We have a pre-op tour that happens every week that we bring children through, and it can be either children that are going to have surgeries coming up, or it can be just people that are interested in seeing our facilities and what occurs and what goes on. So educate yourself as much as you can about what does my local facility have, and who are the resources there, who are the people there. Go ahead and meet the nurse manager. Go ahead and walk through or take a tour. Watch the processes. Talk me through what happens if I had to come in an emergency, so you can understand the processes. Well, you're going to be triaged, which means somebody's going to greet you at the desk, going to ask you a series of questions that helps the nurse determine how urgent is this, given the 5 other people I just walked in who are having heart attacks or stroke or whatever. Your child, we can the following with, give some Tylenol, give them this and that, and we've got an hour window before really the physician has to engage with your child, where these children or these people that came in before you, it's very emergent that we have to get to them right now. So you can understand that process, because I find parents get very frustrated, why am I waiting out here? No one's seeing my child. And usually that's a good sign. If you're waiting out there and no one's seeing your child, it means the child's probably stable enough to sit out there and wait. So you want to check on that. But sometimes as you share with them at the triage, you're concerned about your child and what's happened in the past when this presentation has happened. It's important for them to know that, because they may say, okay, the child looks okay right now, but you told me last time within 5 minutes this child decompensated and went to this, we're taking him back right now. So that's why, given a history, given previous presentations and changes and what happened, is always an important history to give to the people when you first come in. Okay? So that's really my greatest things on advocacy when I talk to parents. You know, as nurses, I say that's my number one role, is I'm an advocate for the patients and families. And I'm an advocate not just for nursing care or nursing, but I'm an advocate for the healthcare facility and healthcare treatment, because nursing represents healthcare. And so my goal is really to advocate in every way for every patient and their needs and how they come through. And it's to work with the family and the multidisciplinary team and that advocacy to make sure that you get everything that is available and resourced to you. But that only is the most effective when the parent is also the biggest advocate. When the parent is really not afraid to advocate, not afraid to speak up, not afraid to hand us things, and don't be intimidated and feel any less than solid about your role and what you're doing. And then we're partnering together, and I can assure you we'll get you through and everything will get great. Oh, the only other thing I didn't talk about, I wanted to mention just briefly, is traveling. You certainly traveled here, and many of you from a lot of different places, and you knew you were coming here, and some of you may have been here before. But how many of you were aware of what facilities we have here for healthcare for your child when you made your reservations and came here? A couple? So as you travel, and you're going to travel, I mean, you know, things come up, and with our world now so easy to get around, I would really strongly advocate you to look at, as you're going and traveling to places, what are the resources to you in those locations? As I looked at many of the cities around here, there are some great facilities around this country and great facilities for you. And how nice for you to know you have them already. You know where they are. You know where they're going to be. So you know if you're staying here at this courtyard, you know exactly how far it is or where you're going to have to go if you have to go to Rady Children's. How do I get there? You know, how do I drive? And now everybody's got their GPSs, so maybe you don't worry about maps as much anymore, but you have a feeling or idea of where you would want to go or how you would want to go. Same if you were in San Francisco, let's say, where would you go? Where would you think? So look that up and have a plan and have that ready to go, because again, the last thing you want to do is planning for that when you're traveling or wondering, and that will just give you a peace of mind that you know where you can go and where you can go to, and you don't have that worry again. And as you've got your little thumb drive and you've got your information and you pack that in with you, you know you have everything regardless of where you go. And regardless if it's a pediatric institution or it's a big other medical institution, you have it ready for you and ready to go. So what questions do you have for me of the healthcare? And boy, I have no ties. You don't have to say what place, so if it was Rady's, you can whisper that in my ear, but, and I'll look into it. But if it's other places or other encounters you've had, what has been, and I'll see if I can give you any tips or any words of wisdom, what are some of the encounters, some of the difficulties that you've found with your child when you've entered the healthcare system, either in a primary care kind of setting or all the way through to a hospital tertiary care? Anybody? You've all had wonderful experiences with your child in healthcare?
You're asking for our most frustrating?
Yeah.
I think it's that every time you go to a doctor, you can tell they haven't read your file. And so you're always repeating the same thing over and over. That history, that's why I'm loving the thumb drive. I mean, I hope they look at it, but it's, you know, to me, that's the most frustrating thing. It's just, I feel like I'm constantly starting from day one to current every time I go see a doctor. And I know it's on their computer. So.
Yeah.
Can you just repeat that so the live stream?
Oh, I'm sorry. So her question was, or her comment was, the most frustrating thing for her with healthcare and encounters is that she has to repeat herself and tell the same thing over and over again, and it feels that people aren't reading her file or not looking at it and keeping up to date. And she's hopeful a thumb drive will make it easier for them to plug it in and look at it. But that is frustrating. I will tell you, at Rady's, that's the #1 comment frustrations we get about physicians in our facility in the general medical. We are a teaching institution, so we have medical students, interns, residents, fellows, and usually, and especially a child with an unusual presentation is going to get that whole gamut because they want to do teaching. So the medical student will go in and ask a history, and then the resident will come in and ask the history, and then the fellow comes in, right? Many of you, I know you've had to experience this, because they'll say, Jacobson's, well, we don't know. oh, hey, go check that case out or go talk. And so, yeah, you're probably over and over again and repeating it. And I think that's what's good about, you could say, you know what, rather than me tell the story and miss something in the history, I'd really like you to go read this. This has a very comprehensive history about my child, and then come back if there's any questions specific to the history that you've read, then you know they've read it, that I can clarify or answer questions to. But relying on me to be the caretaker of historian for 5 times, I'm going to miss, because I'm going to be tired and I'm just going to give you an abbreviated version, and that's not really what I want you to have. I want you to have a comprehensive. Does that sound helpful? You're not alone. I will tell you that in children that get admitted just, for, bronchiolitis. So it's frustrating. What else? Yes?
Yeah, my grandson had he was born with just one testicle, and
He's going to bring in the mic,
Oh, I'm sorry.
just so the live stream people can, otherwise they won't hear you.
My grandson was born with just one testicle, and they went in to descend it and said no, he was born just with one, it wasn't there. So that was about 3 or 4. So when he was about 12, he was on a roller coaster ride and something happened. Ended up going to emergency, and they thought it might have been appendicitis. So they took him to a hospital. I don't know if you want names. I don't know. Should I say any names? Chalk Hospital, and got him there. He's in agony. He's crying. I mean, he has a high pain threshold. He's begging you to help him, and also they're doing everything. They put him on morphine, and he was there for over 3 days, and the morphine didn't even touch the pain. And we're going crazy. And finally, the lucky thing happened. They come in and say, "You're at the wrong hospital." So they took us to Miller's Hospital in Long Beach, and I mean, as soon as, and if you look at the hospitals, Chalk is this beautiful, clean-looking, technology-looking hospital. We go over to this one, and it's like, I'm not kidding you, it looked dingy and dark. But all of a sudden, 7 people come in there. And they're talking, and they're going, no, it's not, this is just not possible what they're saying. And so they get our permission to do exploratory, and the next day they take him in, and they find out that that testicle was there the whole time. It had ruptured. And so they took it out, and he's fine. And just really, really good. But the only funny thing was that's the same hospital who couldn't find it to start with. But they finally found it in the wrong way. But we were so frustrated with Chalk. I was so mad when they said, I mean, they never mentioned doing anything. For 3 days we kept saying, you've got to do something. He can't take this. Well, we did. I honestly think because he had what he did, they were afraid to touch him.
So just a little bit from what you've shared with me and history, here's a couple advocacy things I could tell you. When you have a concern and a child, especially a child in pain, pain's something that we really escalates for us to be a high priority. We don't want adults in pain either. Hopefully, if I speak to an adult facilities, they'll say, I don't want to be in pain. So pain is a high priority for us. So a child getting morphine that remains in pain is a very cardinal sign for us. There's something pretty major. And so when you find things like that or a length of time, as you're talking about, and they're not able to give you a reasonable what the activity is or whatever, that's when you really, again, become the patient advocate, and you can advocate and say, I need to see somebody else. And you can go all the way up the channels to the chief of staff and say, I need to see.
Chief of staff.
Yeah, okay.
Have the chief of staff.
Okay, so there's, and there's another medical director, or you can say at that time, yeah, I need an outside consultant, I need somebody else to come in. Or you can remove your child and take them to another facility.
They did it for us, which I guess we're lucky in it.
Yeah.
Fine, but that was
frustrating.
That was scary. This child has a pain threshold out the window. For him to be crying and begging you.
And did you share that? Did you share that information that he had a real high threshold?
Yes.
Good, good. Because again, that's like what I talked about pertinent information about your child. If you're looking to know, this child normally under these kind of situations responds this way. Responds right away to Tylenol or right away, and they're not, whatever, that's really good.
As soon as he got off the, roller coaster, he's walking, he's like, I've got to go to the hospital. We're like laughing. We said, sure you do. He said, no, I want to go now.
Wow.
He asked to go. And so we took him and 3 days, and he's screaming and begging you to help him. I've never felt so helpless in my life. So
yeah.
That was really, really bad.
Those are tough ones. Those are tough cases. And especially sometimes it takes some time. I think this is the hardest for families is sometimes for some presentations or some situations, it takes a while to do a workup. It takes several tests, or they want to get one test back to see how that one came before they escalate it to the next. And always trying to do the lowest level. That could be so difficult for families waiting, saying, when am I going to get the answer? Or when? And sometimes we don't have the answer. And then other times, yeah, we have to send somewhere else where the experts are or something else that can happen. But very frustrating.
I have a similar situation where our daughter was in a hospital in Detroit, and nobody didn't make a decision about what to do with her. She was in the hospital for 4 days, and finally my husband, and they say, oh, well, this next other type of doctor will decide what to do. And we would say, okay, well, when will they be here? Oh, not for 8 hours. What? And then they would come and say, oh no, it's the other doctors who are going to be deciding. So we finally, my husband said, take her RV out, we're going to this other hospital. And that's what it took actually to get them to actually make a decision and bring somebody in to do something. And she was suffering for 4 days as a 3-month-old baby. It was heartbreaking. And this is one of the reasons why I was really wanting you to speak today, is because we didn't really know what to do, because we were brought up with a doctor or the expert. And we don't know anything. I mean, our baby was very new. She just had a diagnosis, 2 weeks before that or something. And just to be, to address that, just how could we maybe have handled that in a way that might have made things happen like that?
Yeah. Well, I think in healthcare, we're used to a time frame that's different than a parent time frame. A parent time frame, I tell people, your child cries for 1 minute and it's a nightmare, right? A child crying and whatever. For us, we don't have that same urgency or that same sense because we see it all the time. So we're a little bit number to it, or you've got far more concern for that. Or parents that will come in and say, they've been, they threw up 3 times, and we're like, well, okay, But for a parent, that's, scary. My child's thrown up 3 times and all that. They're dehydrated, where we look at it, we just look at the presentations and look at things differently. So I think getting clear about time frames and getting clear about plans is really critical, because I find physicians are the same way, but physicians are excellent at telling you, usually, I don't want to be too global, but physicians will tell you when asked, what is the normal time frame for you to look at this? Or what is the time frame that you're expecting that this will change or happen? Or what is the time frame to get an expert in here or get a decision? Because we're concerned and we want this. So if you put that caveat to them, I know you're looking at that and you're working it out, but what is the time frame that you're expecting that we will get an answer or we will get this done? So start asking for that kind of commitment, because then if you don't get that, if they say, well, I don't really know, we're going to wait or we're going to see, say, no, I'm uncomfortable waiting and seeing or whatever, I need to know more specifics or get it more definitive. And if not, then you can do as you did, say, then I feel like if you can't provide that for us or a good explanation for that, then we're going to have to go look and see if we can find that somewhere else. But usually if you tell a family or somebody what it is you want and what you're looking for, I have found some physicians when we've escalated it, because residents and interns and fellows sometimes are in their minds still working it out. But when we've escalated it to the attending and to the real experts, and we tell them, or say this family really wants to know, they need a time frame, they need to know the plan. They're really good at, I'm probably stepping on something, cutting out. They're really good at then formulating that for you. They just need to know that's what you want, because they're doing it, they're planning it. It's just not the way they tell. They'll do it to residents and interns as they're teaching, but they tend not to gravitate to tell families that unless you specifically are saying, I need to know. We talking 8 hours, 24 hours, whatever, and what's your plan in that 24 hours? Because I'm not comfortable having my child in pain for the next 24 hours. So what's your plan for that, or to mitigate that? So that's the advocacy of becoming the partner with them. We're a partner in the plan. My plan is to not wait 3 days to find out what's going on, because my plan is to go to the next place to find out. What's your plan? So that they can share, this is the plan. And then if you're in agreement and go, that plan sounds reasonable to me, that plan sounds like something I can live with, or sounds like, and I'll continue to get updates, then you're on board together. But if you're sitting there and you're waiting or you're unsure, that's when you have to speak up and then ask, I need to know. And say it exactly what it is that you need to know. I need to know what is going to happen in the next 8 hours. I'm going to be sitting here at this bedside with my child. What is going to happen the next 8 hours? And they should be able to tell you that. And oftentimes, again, the nursing staff and people will give you, are also a good purveyor of information in that way, to talk to the nurse. What have you seen in the past with this similar? Because some of the things sometimes you're waiting on really don't have to do with Jacobson syndrome. It may be specific about your child's presentation, but it may be something, let's say, I see in the ED all the time, an appendectomy. Child comes in, we rule out appy. And there's a time frame to wait to go get the CAT scan. There's a time frame to wait after the CAT scan's been read. And there's a time frame to wait for the consultant to the surgeon to know, and then to book an OR, and then all of that. And we see them, we probably see 6 or 7 appies a day. And I know that time frame, I know what that's going to be. But a parent who's got a child in abdominal pain, and is concerned and all that, doesn't want to hear you're going to have to wait 2 hours to get into the CAT scanner because they just had 5 traumas and they're backed up or whatever. And well, what if it ruptures? What if they want to know? So you've got to go through all those questions and say that. And people will be able to tell you that time frame. It's usually about 40 minutes after it's done, it's read. We'll get it right to the surgeon. I'll update you after that's been notified. Surgeon will come in. And if the surgeon doesn't come in an hour, you say, where are they? I need them to come and do that, or I need to speak to them at least, or somebody else to come and talk to me. Because sometimes the urgency of you is not the same as the urgency of the healthcare providers. I think your urgency goes down when you hear and they say, no, we're not worried about rupturing this part, we're not worried about this, we've got plenty of time here to wait, we'll give some narcotic, we'll give something for pain control, and you'll be fine through the night and going through the OR in the morning. Sometimes you just need to hear that, and you just need to ask for that. What else? Yes?
Okay, thank you for coming. My question is sort of related, but how do you advocate for services that you want that maybe either your primary doesn't feel are necessary or insurance doesn't feel are necessary?
Yeah, that's a tough one. That's what we're all probably going for. I think what you do is you look for what the resources are in your community. So there's a lot of resources in the community that aren't tied to a provider or to an insurance company. So here in California, because of the tobacco tax and everything, we have this First 5 initiative that everyone has access to, and they have a variety of services that are offered through this that are free and aren't tied to insurance or tied to whether or not you get a referral from your provider or whatever. So it's finding those communities. We just hook people into, here's the people that are running, the First 5 initiative, and we hook them in the community to those resources, and then they take it from there and they lobby everybody in. And then you get people from those community services that then refer back to your primary and say, you know what, this child can really benefit from this, and we're willing to provide it, whatever, or we may need an order from you for this, just to cover our services, to track that we are providing it, because there's a lot of records everybody has to keep. So I would do a very extensive study of your community and your surrounding community of what are the resources that are available, and going down to your county health department, going to your hospital facility, asking to speak to case managers or social workers. I find social workers are the most knowledgeable about what resources are in our community. When I want to know about something, I go to my social workers and say, okay, what if I have a family with this, where would I send them? And they know, because they deal with it so much. That's part of their role. So I think if you explore that, you'll be surprised what really is available that no one's told you about.
Hospital would have like a social worker that can help me even if we're not a patient there.
Yeah, well, you can always make an appointment and ask and say, you know, this is what I'm looking for, and call their department, and usually they'll hook you up with somebody and say, yeah, we can have you meet with so-and-so, she's available at this time.
Yeah.
So I would try that. The other thing is a public health department. That's what your taxpayer money and everything goes for. So meet with a public health department, and there are community social workers connected through that, so you could talk to them as well.
Hello. Oh, are you done, Jessica?
Yes, it's fine to turn it off.
To follow up on...
I hear a voice, but I don't... Oh, there you are. I was like, I hear, but I don't see. Okay.
To follow up on the discussion, I'm from the Seattle area, and we're very, very grateful to have UW and Seattle Children's Hospital. Being though that they are both teaching hospitals, at times we're asked if it's acceptable to have a resident or an intern come and sit in with us, and we appreciate that in our clinic visits. But I found myself almost traumatized by the overwhelming amount of people that will come in and ask over and over the same questions, even if they have the documents in their hands. And I'm just wondering, how can we encourage the teaching of our medical people who ultimately are supporting us and our children, but also during really emotional periods, not feel like we have to undergo that? I mean, is there a balance? Is there a way that from a hospital's perspective we can handle that carefully and say, thank you, but no thank you? What would you advise, just based on your experience, having a parent come in with that type of feeling? And usually it's, you know, it is in the ER or the burn unit, as in our case, where it was just too much.
Yeah, and being honest and saying that is the best that you can do, and to get the ball rolling. We have families that say that a lot to us at Rady Children's, say, you know what, I'm just burned out on it. You know, I love teaching, I want to be it, but for this particular hospitalization or for this particular event, I really need to be just interfacing with the attending. So you find out who your attending is, or you talk to your primary physician that admitted you or sent you in. I don't know at Seattle Children's if they have a hospitalist program. Have you ever heard that word? Do they, Dr. Christopher?
No, I'm not sure what that is.
We'd almost bet they do. That's almost it.
I would think it's pretty standard now. No, it's called a hospitalist, which is a physician that oversees patients in the hospital under the teaching program. So there's a hospitalist, and your primary care physician usually admits to the hospital, and they rarely, did your primary care physician come in and see you during this day? Yeah. Then they turn over care to the hospitalist. So what they do is they admit you, and then they give a report to the hospitalist. I'm admitting patient so-and-so for this, this, and this. And then from there, the hospitalist, that's their transfer of care. The hospitalist, during the course of your stay, now is the person that's in charge of your medical care.
Unless the admission needs to go to some specialist.
Yeah, unless it goes to an ICU or a burn specialist or whatever. So the hospitalist is really for general. Yeah, and so you can ask, who's my attending? Who's my attending physician? And then I would say I'd like to see them, and then have a conversation with your attending physician about, you know what, this is my situation, this is what I'm concerned about. I don't mind you sharing the information about my child and using it as a teaching case, but I really don't want to be engaged in all the things that go on with teaching, about having to repeatedly talk, have repeated people coming in and examining my child. If you all want to do it together, oftentimes they'll come in when families have said that. They'll come in as a team. So the attending comes in, and the attending's dealing with you, but the residents or medical students are all there as well. So everybody gets to hear, everybody gets to see, but you're really talking and dealing with one person, and then you don't have multiple encounters. So I would just have that conversation with them about what your concerns are, what your needs really are, and be very expressive about that. There's nothing demanding that you have to.
And I don't want to drag this out too long, but I feel like once we were settled, that people were really honoring of that. It was the intake process. And I'm wondering, is this a type of thing that we could just bring a sheet in and do something similar and say, we don't want your pediatrician and your internist and your ER doctor and your nurse and 3 other people to come in within an hour period while my child is crying hysterically.
Yes.
I am too.
Yes.
But, well, I'm not that nice in those incidents. And so, I mean, and then that sets the care. Then
yes. That's our worst barrier, is we want to be nice. And we don't want to hurt anybody's feelings. And we don't want, and we don't want retaliation. We don't want them to be mad at us so they won't treat our child well, right? I mean, that's probably, I think I'm stepping on something that's probably our biggest fear. I don't want to irritate anybody so that they won't treat my child the best they can, right? I think that's all of our fears with it. And I just have not seen that. I've seen parents that really are strong advocates and are very vocal about their needs related to their child. Because what you're saying, it's not that you're bugging me, this is disturbing to my child. Again, it's taking that specialty about your kid and saying this is what is most difficult for them in this kind of situation. Too much stimuli, too many people coming in, too much distraction by me. So if I have to turn and talk to you, then I'm not focusing on them, and that becomes a problem. So I need to have one encounter. So come in, get it all done, and then go. Go ahead and express that, because when they hear why that is, it's not that I don't like residents, it's not like that I don't like teaching, or I don't like, that's not the currency that I'm concerned about. I'm concerned about my child and how the healthcare interactions will go with them along the continuum in this particular presentation. You could do it right up front. If you walked into my ER...
with the pediatric resident, and it wasn't received. So I think that's why I was just hoping for some...
Yeah, you know, there's no magic potion on that. If you don't get, I would say just escalate it again to the next person and escalate it.
I think from my experience, you know, and this happens every so often. Sorry. Yeah, this happens every so often in my, you know, where I am too. And I think it's a lot of it just has to do with the delivery. And I think, like you said, sometimes, you know, if you feel like it's offensive, you know, that's going to be perceived a little bit differently than if you just kind of reach out and say, you know, I'm just overwhelmed right now. Would it be okay with you if we just limit the interactions to the attending? And I think, I would dare say most attendants are going to be very receptive to that, especially since I became a parent 7 years ago. I see things a little differently now too, from that perspective. And so, again, I also realize it's not so easy to be so composed when you're in a situation of duress like that. But I think, like she said, just being honest and just, you know, kind of just put it out there and say, I'm just a little too overwhelmed right now to handle the extra staff. And if you could respect that, I really appreciate it. I just can't imagine any reasonable person not honoring that.
Well,
I agree.
I just want to thank you both, and specifically for helping us navigate this. I feel like it's a gift.
Oh, well, it was my pleasure to come. I wish I could give you more concrete things to do. I've tried to give you a few, but it's a challenge. Healthcare, as you read, everything is a challenge today, and just keep advocating as you are. Your child's the most important, and you will find somebody in that continuum that will help you. Okay? Thank you.
Thank you, Lesley. And also, I was wondering, would it be possible for us to get a copy of this to put online so that the people who are not able to be here could have a copy of
Absolutely.
this?
So I will email that to you.
Yeah.
Is that okay? Yeah. If I could email it to you.
Absolutely.
And if you are in San Diego and you want to ever come see Rady's when you're here or do anything, please feel free to contact me. She knows how to get me.
And this is a little gift for you. Thank you.
Thank you.
I think also just as sort of an extension to this discussion, this really speaks to the importance of the protocols that you've heard us talking about, the one that we have now for bleeding and hopefully for immune deficiency. So again, that just empowers you to be proactive. So